With regard to urine specimens, the following 4 things need to be always kept in mind. First, the container itself. Any urine specimen container needs to hold at least 50 milliliters and have a wide base. The container should be sterile, leak-resistant, break-proof, and have a secure lid. Containers are used only one time and then discarded with other biohazard material. Secondly, you need to think of collection. Once you have the appropriate container, a specimen may be collected through straight catheterization, drainage from a Foley catheter, or directly from urination of the patient. Now, the staff handling the container and the patient should both be instructed in proper use of collection, and they should wear gloves. The containers need to be labeled properly, and the label should not be put on the lid. And because if you put the label on the lid itself might become separated from the container, and then you have no idea who the specimen came from. Next, when thinking about urine specimens, you need to think about transport. When transporting a urine specimen, you ought to take the original urine container, the specimen container, and place it inside of another container, for example, a Ziploc bag. This is critical because there might be some urine on the outside of the container, which would then spread contamination. So by placing the specimen container within another container, you increase safety to those around who are transporting the urine specimens. And then finally, when thinking about urine specimens, you need to think in terms of storage. When storing the urine specimen, it needs to be in a designated area, and it needs to remain inside the transport container, once again, to prevent spreading of contamination that might be on the outside of the container. When collecting urine specimens and thinking about them, the following 4 things need to always be known and remembered. First, the container, at least 50 milliliters, a wide base, leak-resistant, break-proof, and have a secure lid. They are only used once and then discarded with other biohazard material. Collecting them in multiple different ways, straight catheterization, drainage from a Foley catheter, or from direct urination of the patient. But when collecting, both the staff and the patient need to be instructed in proper use and wear gloves. And once it is collected, it needs to be labeled properly, and the label should not be put on the lid. Transported within another container for safety, and then stored in a designated area and remaining within the transport container.